Hi everybody, Tim Emerson of Kuan Yin Healing and Kira. So, in holistic healing, what works? Unfortunately, the studies on alternative medicine and holistic healing are generally in a dismal state. Many are done with small samples, 13 in one study, or based on subjective observation, like the mice seemed less anxious, or they're done by a group looking to show why its own modality is valid versus independent verification. Or they're done by a researcher expecting to find the placebo effect. And acupuncture, for example, has been judged to both help neck pain and headaches and to be completely ineffective. Poorly matched to treatment. One massage study on pain found negative results for 30-minute sessions, but positive results for 60-minute sessions. An energy healing study compared to physical therapy featured just 10-minute treatments and decided the results were inconclusive. Or surveys of the literature, flawed because they condense flawed studies, usually done by holistic practitioners versus independent research analysis. But look, all is not lost. We do know something is happening. Yes, the claims are all over the place. Yet, I have also seen remarkable healing I wouldn't have believed. But can we see these reliably? Even if we don't know how precisely things are working, can we use them? Even something as vague as energy healing. While I can share stories of various diseases healed, we can't promise those results, but there are some areas yielding measurable results, range of motion and pain in particular. And not only subjective experiences of pain lessening, but actually the disappearance of the underlying cause in some instances. I suffered from lower back pain for a couple of years due to incurable degenerative disc disease. Both the pain and the disease are gone. One of my clients had neck pain for a year from a dislocated disc following an auto accident. Her chiropractor told her, "I don't understand it, but your C1 vertebrae is moved back into place," relieving her pain. Her high blood pressure dropped to normal too. An ex-professional dancer suffering from sciatica, a painful nerve condition. An ex-professional lacrosse player using a TENS unit for back pain and a foot nerve injury. An ex-firefighter whose tired body could barely move. A martial artist who was on the verge of giving it up, all found relief from pain and recovered mobility. We do have some studies, though, that confirm energy healing as real, while others are no better than placebo results. The connective healing work Kuan Yin Healing uses has been studied, for example, in a few ways. One of the most useful studies has been participants sensing whether energy is being sent to their left or right hands. At first they're guessing, but after a learning curve of a few days, they consistently get it right. Another study shows the energy field of clients expands during a session. Still another shows that practitioners' heart variability rate slows, and the client's brain waves slow to match. How does this equate to healing? We don't know. But even in the scientific sense, we don't understand energy. Renowned physicist Richard Feynman, in the updated millennial edition of the famous Feynman Lectures, notes that physicists don't know what energy is, goes on to explain that nonetheless, theoretical physics can advance through practice and observation. The same is true for energy healing. We can observe the phenomena and the results that follow for our own understanding and evidence of its efficacy. Not everyone sees the results, though, so how do we know whether a particular holistic approach will work for a particular individual? I wanted to know the same thing, and so I started studying both various approaches and my own clients to see who was getting results, who wasn't, and what these people were doing differently. I found there are three main distinctions. First, instead of matching problem to approach, holistic healing is often consumed as trying modality after modality, in essence as if it were another pill to take. Our drug treatment approach to health is surprisingly rooted. If we don't take drugs, we look for the right herb or tea or technique to take to magically remove our troubles. And sometimes that works, but pain is often more complex and more stubborn than that. Magic won't work. If you need a medical procedure, you don't find which ones work, you find the one you need, right? Cardiology and proctology are both important, but they're not interchangeable. Also, because we're so rooted in trying things, we bounce between polarities. We go to alternative healing but keep the mainstream thought system, often seeing these as a dichotomy of natural, pharmaceutical, or spiritual, physical, for example. It's like trying to lift a heavy board by one end, deciding that won't work, and then trying to lift it from the other end instead. Sometimes, even often, we become quite good at some of these things, but because it's only part of the picture, we don't yet see results. So it's like trying to get a car into good running order. You fix the brakes, but that doesn't work. You try the fuel pump, that doesn't fix it. So you try the spark plugs, etc. But the problem is your car needs all those things to run well. So if you're in pain, you have probably tried a lot of things. If you're still in pain, you know why that approach isn't successful, right? You're still in pain. But maybe you got lucky. You found something that worked. All the other pieces happened to be in place, so this additional piece did the job. Awesome. But how do you get all the pieces in place? That's number 2. The 4 pillars of the healing equation. Clarity, connection, coherence, and change equals results. You need all 4 to get consistent results. Just as a table with a missing leg isn't going to work well, neither will approaches missing any of these 4 pillars. Let's start with the second one. We'll come back to clarity in a minute. Connection is the one most typically associated with energy work. Whatever the particular modality, the energy of the client is connected to supplemental energy of some sort, whether newly generated or already existing but not being used efficiently. So that can work, simply because sometimes the other elements are present sufficiently to accommodate healing. We're a continuum from physical through emotional, mental, spiritual, and highest self to the divine, without break or separation, and we certainly want that pipeline clear and functioning. But for effective results, we need the other elements as well. Cars don't run just because we have gas in them, unless the route is downhill. But whatever the approach, it needs to be a connection outside of oneself. Why? Because your own efforts have brought you to this point of pain. You need help. Now, coherence. Coherence is how the various parts of our energy resonate together. A cardiologist, for example, isn't going to stop at heart surgery, but rather insist as well on dietary changes, no smoking, and so forth. Anything short of this would be incoherent, and so with that person's health. Now, in energy work, coherence means the physical, emotional, mental, and spiritual aspects have to be working together in the same direction in harmony. Connection can promote this, certainly, but a physical cure, ignoring the energetic whole, is only treating symptoms and temporarily. Remember the last time you were emotionally distressed or under mental duress? How did you feel physically? Not good, I'll bet. This is why coherence is important. Attention to coherence will help you identify what to change as well. WebMD notes that negative emotions, such as sadness and anxiety, seem to aggravate chronic pain. People who dwell on their discomfort are more disabled than people who take their pain in stride. Even poor job satisfaction can increase pain because chronic pain affects all aspects of your life. It's important to treat chronic pain both medically and emotionally, WebMD concludes. Coherence matters. Now, change. Change is essential. As our cardiologist friend insisted above, if you want different things to happen, you'll have to do different things. I can't have a clean house the same way I got a messy one. I have to change my habits, behaviors, and procedures. And if you have long-term pain, something different needs to happen. Sometimes change is difficult. We all tend to cling to our respective comfort zones. Recognize, though, that this is a recipe for the status quo. All progress, all improvement takes place out of that comfort zone. Who we are now is how we got what we have now. We will have to step into new ways of being to move into new manifestations of that energy. Very often, people have their own way of addressing their pain. Okay, consequently, they resist new information and approaches. Fair enough. But when I ask them, so how's that working, they tell me, well, it's not really. Really, it's time for a change. So, back to clarity. Clarity, the final pillar. In practice, this should be the first one. What exactly is the problem? Very commonly, people are trying solutions that address the wrong problem, which is why those aren't working. Likewise, what exactly do we want to happen? If the desired outcomes are vague, then the strategies for reaching them are going to be fuzzy at best, which means they aren't going to work well, if at all. When I smashed up my knee, my doctor examined it, diagnosed the problem, and then asked, "So what's the goal here?" It's a smart question. It determines the appropriate treatment. Yeah, I want the pain stopped, but are we going back to climbing mountains? Are we playing pro football? You just want to walk? It matters. Sometimes people find healing for something other than they thought they wanted. When we're in pain of some sort, physical or emotional, we may have difficulty naming what we're truly seeking. It's hard to be honest and insightful with ourselves when we're suffering. Until we are, though, we won't know what we're addressing. It's okay for clarity to come in stages, but note that this clarity is the compass for all the rest. As long as it's fuzzy, so will everything else be. With all four pillars, clarity, connection, coherence, and change, we can be comfortable knowing we'll find results of some kind. Actually, we have to. We know what we're addressing, why, and what we want. With all four pillars of the healing equation, we tap into a greater network to access the resources to do it. Clarity helps the connection to work with coherence, rather than the different parts being at odds with each other. There's a direction, a unity, a purpose. And that clarity of direction and purpose will take us out of our comfort zone into the new habits, thoughts, actions, and approaches needed to complete the needed change. Progress of some sort is now assured. That's the power of the four pillars of the healing equation, whatever terms individual practitioners might have for these pillars. And it's also the danger of omitting any of them. All we need now is a systematic approach to ensure those criteria are met. And that's really important. A cohesive, comprehensive system is the key to bring the pain relief people seek, sometimes more than they know. That's what I'll address in the next video, the cornerstones. Until then. Hey, if you would like a free article, a free booklet, 10 mistakes that keep people from finding the healing they need, just click the link down below. I'll be happy to send it to you absolutely free. Okay? Take care.